Welcome to Reformasi Dispatch. I'm Jeff Hutton, the regional correspondent of the Straits Times of Singapore.
And I'm Kevin O'Rourke from Reformasi Weekly.
Kevin, it's good to see you. It's the first time we're doing this.
Yeah, good to see you, and thanks for the introduction. I thought I was here with Chuck Norris for a minute there.
The beard.
But
yeah, the COVID beard. I haven't been able to see my my barber in a month, so this is the longest my hair has been. It's causing a bit of ructions at home. Yeah. Well, there's really only one topic that we want to talk about, from which all things seem to flow. It's COVID. And after a discussion, Kevin, you and I are talking with Irwan Teguh, the head of Indonesia research at CGM CIMB Investment Bank. I thought we just had it. It was pretty good.
Yeah.
And I think before we dive too deep, I just wanted to share an anecdote about the moment we're in, and just when COVID stopped becoming something I talked about for my job, and something that was, frankly, a little bit of a nuisance, and really sort of hit home. And that's a friend of the pod, Andreas Arsono, tested positive for COVID and had to go into. And I'm not talking out of school. He's been posting on social media. He and his partner and his 9-year-old daughter all tested positive, and they had already been fully vaccinated. Of course, not his little girl, who is too young to be vaccinated in any case. But that was really terrifying for them. Was that, of course, he and his partner had been vaccinated, and that's concerning enough. But his daughter had not, and that was this worry, like, what do I do? Like, where can I go? And then his own health started to deteriorate, and he needed medication. Thankfully, everyone's fine. They're about 15 days into the infection, and their symptoms are now minor. And his daughter never did develop symptoms, but that I put myself in his shoes, and I could see just the fear and the helplessness that millions of Indonesians are facing right now, and just that question, what do I do? And my little girl's got it too. I can't imagine that just stark fear.
that's right. Yeah, absolutely. Because plenty of people are fully cognizant of the risks and the implications of the disease, and they're also well aware that the healthcare system is really pretty much beyond being able to help them at this stage, with hospitals just overflowing and oxygen often in short supply. So, and it's such a terrifying disease because you can be asymptomatic one moment and then be really oxygen deficient just a short while later, and not even notice the hypotoxia. So there's a lot of people that are really in distress right now, and it's percolating through society and politics in a lot of different ways that are evident. And events are moving very fast right now in Indonesia because of the crisis. But I think hopefully there's some data we can talk about from Jakarta that suggests that maybe this is the moment when the tide is turning and things might be improving for this particular wave, at least.
Well, the headline numbers that people are hearing about, the record 54,000, that's across the country. And the deaths with it are mounting to more than 1,000. In fact, 1,025 died just on Friday alone. And just before we move on and go deeper into the numbers, I just wanted to ask you, at the outset of this, more than a year ago, you and I would have discussed for stories when I was calling you, even before we started this podcast. You must have had a sense of what the pandemic would play out, most likely on a balance of probabilities. How does this moment compare to your your hopes and your fears at that time? Is it worse or better, or have there been surprises? I'm curious about your take of this moment.
Yeah, I'd say it's similar to my worst fear in terms of the distress that we talked about rampaging throughout every corner of the country. I think what's maybe a little bit encouraging, relatively to those days or moments at the outset of the pandemic when there was so much unknown about COVID, is that the mortality rate for the disease is not quite as bad as was feared back in early 2020, and therefore, there's far too many tragic deaths, but it's at least not as bad as a historic plague dimensions.
Well, yeah, I mean the initial SARS, and yes, the mortality rate could have been much worse, but I guess that the awful reality is that Indonesia's healthcare facilities, its ability to take care of its sick, has always been rather limited, and so this pandemic was going to hit upon that, and so was going to come up against that. So in today's pod, we're going to be discussing the numbers you really should be listening to. That there is some expectation for things to turn a corner, vaccines, cut and kerfuffle, and just the overall the public perception of the Widodo government. We have some new polling just out. I think, did you say today? Today being Monday. It just came out today, right? The LSI numbers.
Yeah. So the president's approval rating has dropped to 59%. This is according to a good survey firm, Lembaga Survey, or the Survey Institute. And the polling was done in late June, and the results just came out yesterday. Unfortunately, though, this is a telephone poll. That means that it misses basically the kind of lower 30% of society in terms of income levels, simply because it reaches people using their handphones. So it's a little bit of a more of an upper strata view of perceptions and opinions, but the trend over time is comparable. Within the group surveyed by telephone, there's been a drop in approval for the president, which has ranged as high as 70% during this second term. But it also has been actually a little bit lower than it is today, and that was in October 2020, a little less than a year ago, when the omnibus law passed and there were demonstrations and riots, and there was a drop at that point too. So basically, Widodo is still popular overall and has ample support. 59% is a level that's enviable for a lot of world leaders. So the impact of the pandemic and this crisis that's unfolding is showing up in his approval ratings, but it's not something, I don't think, that's really going to jeopardize his position or incapacitate him. If anything, Indonesia still suffers from a surfeit of stability. There's been a lack of dynamic reform and change, and there's been plenty of political stability for the past couple of years. And that's still the case, actually, even despite dynamics now occurring politically with some criticism, given the severity of the crisis and this pervasive distress that we talked about.
And they could not have been helped at all by the ambiguity and frankly muddle that we've had on the part of senior cabinet officials. On Friday, Coordinating Human Development Minister and Culture Minister Muhadjir Effendi said that President Widodo had already decided that the lockdown would be extended until the end of the month. And that was at odds with comments made by Luhut Panjaitan, who's the Coordinating Maritime Affairs and Investment Minister, said, no, you'll be hearing from us in a couple of days. And indeed, this afternoon, Monday, when we're recording, a couple hours after we're recording this podcast, there will be an announcement about whether they will extend. Seems likely they will. Be surprising if they don't. Though we have to do an emergency pod, I think, in that case. How illustrative is that ambiguity, that confusion been? How illustrative is that of Widodo's handling of the pandemic so far?
Yeah, it's been a chronic problem since the outset, actually, especially when the health minister was Terawan Putranto. Things improved in December 2020 with his replacement by Budi Gunadi Sadikin. But communications are critical during a crisis, and the Widodo administration has been chronically faltering in that area, and it's been particularly bad right now. So this really crucial peak of this Delta-fueled spike is really posing a test of the government right now. And I think most reasonable people would say that the government's handling the pandemic to date has been pretty sound overall. A few gaffes here and there, and not spectacular performance by any means, but reasonably well based on science, reasonably apolitical and sensible overall. The vaccination rollout has been the best in the region, for example. So there's been some high points, but that performance to date doesn't guarantee performance going forward. And the conditions are different now because of the severity of the strike and this incipient criticism and rancor that's developing. And so it's posing a test to the government, and the government's fumbling right now because there's a lack of a clear chain of command over COVID handling. It used to be coordinating economic minister Erlangga Hartarto, and now apparently it's coordinating maritime minister Luhut Panjaitan, although there's been no official announcement about that. And then, as you mentioned, there are these contradictory statements coming from high-level ministers, both coordinating ministers. Effendi Mahajir is the coordinating people welfare minister. And so that's problematic because communications affect the credibility of the government. And during a severe crisis like this, government credibility is crucial in order for it to issue orders and ensure compliance, or make recommendations that people take seriously, or persuade people to behave in one way and not another. If the government squanders its credibility, then it can't do any of those things very well.
We shouldn't neglect to mention that Finance Minister Sri Mulyani has also suggested that really the lockdown should continue well into next month, right around Independence Day, the 17th of August. So there's a lot of competing messages, precisely what you don't want in a crisis. And what I took away from our conversation that'll be coming up after the break with Pak Irwan is that people in the informal sector are in a worse position to handle another lockdown because their savings are depleted, but also that lockdown was timed so that people may have had a paycheck in hand. There may have been some stimulus payments. I understand the THR, the money that you get for Idul Fitri. There was some payment there. That came up in April as well, April 2020. So there was some infusion of cash to get people through the 8 weeks of lockdown. Now we don't have any of that, on top of rising energy prices and rising wholesale prices. So there's a lot less room to maneuver, and all the more reason for the government to safeguard its credibility.
Yeah, it's a real quandary. It's a classic quandary between, on the one hand, mobility causing transmissions to continue burdening the healthcare system and causing deaths, or on the other hand, restricting mobility but causing untold suffering, especially in the informal sector, with bare bones economic conditions right now without the cushioning that was available in 2020. And with these emergency restrictions being in place for basically a full month at least, or possibly even 6 weeks, that's really going to impact tens of millions of people. There was new poverty data that came out that showed that as of March 2021, Indonesia's poverty rate was stable relative to 6 months earlier in September 2020, which is remarkable considering the recession that occurred in between those two dates. And that reflects the intervention of the social welfare programs that the government rolled out. They basically stemmed a rise in poverty during that time. However, that probably can't be expected to be repeatable right now. And so there's going to be 1 million, 2 million, maybe 3 million people thrust below the poverty line. And in Indonesia, that's a very low poverty line. It's measured on the basic number of calories that the human body needs. And so
isn't it something like 80 cents?
Just, there's going to be a lot of suffering.
Something like 80 cents a day?
Yeah, no, it kind of depends on the exchange rate at the moment. So yeah, it's probably a little over $1 right now. Actually, I would guess like $1.05.
You don't want to live on that.
You can't do much with that.
No, you can't.
Yeah. So this is one of the big political issues, though, because a lot of parties now, opposition and pro-government, are calling for another round of stimulus and especially social welfare spending for the poor. The finance minister announced a little bit, 6 trillion rupiah, for 10 million recipients last month for the months of July and August, and that provides 300,000 rupiah per month for those 10 million people, and that's not much money. That's $20 a month. But if you're destitute, it's something. But there's a demand now for much broader social welfare spending, and those demands are getting pretty forceful from political parties. And this is one of the issues that's fraying the image and credibility of the president right now.
One thing that I'm watching this for, and it's a question that I have, is whether or not the government interventions is creating a taste among the voting public that they want more social services, that even after this is over, that there will be demand for regular government intervention. That would be a good thing in my view, but I don't know if you've got a view on that, but it's something that I personally am watching out for. So, okay, into all this is a little bit of ray of hope. We've talked about you get the headline numbers, 54,000. That's nationwide, but in Jakarta, which was the epicenter, and I think still is to some extent, there's reason for optimism. In fact, the 7-day moving average is starting to tick down. You want to take it away there?
Right. Yeah. So what's interesting, actually, is that as of late March, 44% of the residents of Jakarta province, who number in total about 11 million, I guess, 10.5 or 11 million, had some level of antibodies to COVID-19 in their bodies. And that's according to a good serological prevalence study done by the health ministry with UI, University of Indonesia, UI, and also the Eichmann Institute, and even the Indonesia branch of the U.S. Center for Disease Control, the CDC. So this came out on 10 July, and it's, unfortunately, I don't think it's posted on the web anywhere, but it's a presentation that's circulated on social media, and it shows, in addition, that for every one infection up to that point during the pandemic that had been confirmed and recorded by official testing, the serological prevalence study of antibodies in the population from the survey of about 2,500 participants indicated that there were an additional 9 cases that had gone undetected, and either because they were asymptomatic and the person never even knew they were infected, or people had mild symptoms and ignored it, or they were sick but just didn't get tested, weren't able to get tested, couldn't afford to get tested, whatever the reason is. So it kind of sheds light on the true scope of the epidemic beyond what the official data from molecular tests shows. So what's interesting is that those were the numbers as of end March. 44% of the population of the city had some level of resistance to COVID. And then since then, there's been a huge number of infections. The official ones that have been recorded are over 300,000 since that time. Some of those are not Jakarta people, though. Some of those are people from the provinces coming into the relatively better hospitals in Jakarta and getting tested there and showing up in the Jakarta data. So you have to account for that. But basically, when you add in the infections over the past April, May, June, and half of July, plus the vaccinations that have taken place during that time, which are substantial in Jakarta, which leads the country by a long shot in terms of vaccination rates. That's about almost 2 million people in Jakarta who are fully vaccinated. Basically, you're getting close to herd immunity in Jakarta. So this is what I wrote about in my report last week, kind of, with plenty of caveats, but speculating a little bit that maybe Jakarta might be getting close enough to herd immunity in the short term that case detections might turn. And because the daily detections for the province were on a plateau during 6 of the 7 days last week. And then since then, the daily case detections in Jakarta went down substantially from the 12 to 13,000 per day level down to around 10,000 per day for the past couple of days. And that has brought down the 7-day moving average for 2 days in a row now. So basically, the curve on the chart has turned a corner and has started to decline for Jakarta. And assuming that Jakarta is a leading indicator for the rest of the country, then you've got a little bit of ray of hope that maybe some other provinces will follow suit sooner or later. But that could still be a while, unfortunately, given the size of these other provinces and the much lower vaccination rates in those areas too.
And I was quite surprised to hear about the numbers of Jakarta residents who were fully vaccinated. 20%. That's substantial. And you also wrote in your report that Indonesia has taken receipt of quite a few vaccines now, and not just the Sinovac, but from COVAX and from directly from the U.S. too, right?
Yeah, the U.S. vaccines are finally coming through. So there's been 3 million doses of Moderna received, and half of those are going to the nation's healthcare workforce of 1.5 million as a booster shot, just in case their coronavac vaccinations are insufficient vis-a-vis Delta. A question that's very important, which is still a little bit unknown. And then there are Pfizer vaccines arriving, and those are beginning in August with 4 million due then and 50 million by year end. Those are both from America, but they're via the COVAX facility. Then Indonesia is also getting some bilateral assistance, 1 million doses of AstraZeneca from Japan, 500,000 Sinopharm doses from the United Arab Emirates, and then the supplies from China's Sinovac of CoronaVac are steady and still coming in. So what's interesting now, actually, is that until now, the vaccination program has kind of gone in fits and starts. As I mentioned, it's been the best in Southeast Asia. Indonesia has more people actually has jabbed more arms than all but 3 other countries in Asia. So it's only behind China, India, and Japan in terms of numbers of jabs given. Until now, the issue, the rate limiting factor has just been the supply, arrivals of vaccines. Now the vaccines have arrived, and in fact, there's quite a substantial stockpile piling up. Now the issue is no longer, at the moment anyway, the supply, but rather getting them out the door. And I think that's been complicated by the emergency mobility restrictions in place. But it's been odd that the vaccinations per day have bounced around like crazy. There were 2 days last week when the total nationwide vaccinations were 100,000 per day, which is disastrously low, actually. But then the next day, the third day, they reached 2.3 million, which is by far the highest achieved to date. So Indonesia needs to keep the daily average above 1 million and needs to move towards 2 million.
Yeah. What accounts for that yo-yo effect, the yo-yoing of vaccination rates? Do you think just poor record keeping?
It's really unclear. That's a major question. I don't know whether it has to do with the scheduling of personnel, whether it reflects the actual arranging of dates for mass vaccination events. Or whether it's the delivery of supplies or the rate at which batches of CoronaVac come out of the company in Bandung, which is doing the filling and finishing biopharma. Maybe it's bookkeeping and record keeping as well that catches up slowly. It's really a mystery.
And so if 45% of the capital region had antibodies for SARS-CoV-2 in March, and infections have been building, and we can know that for every official infection, there are X number of many more infections. When might, if we think of this, of the pandemic as sort of a fire burning through a thicket, when does it run out of wood? When does it run out of bodies to infect and start reaching herd immunity, do you think? It sounds like it could be next week.
Yeah, well, yeah, I mean, if you do a simple arithmetic, which is my favorite type of arithmetic, yeah, it's next week for Jakarta. Problem is that there's questions like, for example, if you suffered infection by the Alpha variant, can you suffer reinfection by the Delta variant? And if so, how serious is it?
Right.
That's one thing. Also, the Delta variant is more transmissible. We know that. So does that mean that it transmits to more people, or does it mean that it manifests as a sickness faster? And those questions are going to affect the shape of the curve, because if I think it transmits to more people, in which case then actually herd immunity would actually even be closer, because these infections that have been happening over the past 3.5 months have predominantly been Delta infections. And so therefore they would have caused even more of these asymptomatic or underreported infections than had the Alpha variant up until end of March. So yeah, there's and then the 1.9 million people who are fully vaccinated with CoronaVac predominantly. How many of them are sufferers who had infections and then got vaccinated, or how many of them are, had no immunity and then received vaccinations, and how well do those vaccines work against the Delta variant? Those are some of the questions. But with the decline, not just the decline of the past 2 days, but the plateau in Jakarta last week and the decline in the past couple of days, that's an indicator that the herd immunity is getting close. Also, if you look at India, their nationwide curve was extremely steep. When the Delta variant hit in India, the case detections just soared straight up to incredible heights, and then just turned right around and collapsed again within a period of just about 3 weeks nationwide, came right back down to something approximating the pre-wave levels. So could that be happening in Jakarta? Another issue is the positivity. So the numbers of cases per test is quite high. So in Jakarta, it's been well over 30%. So the testing that we're using for these official data are not really capturing the full scope of the epidemic. But on an apples to apples basis over time, is the trend accurate? Maybe.
Yeah. So it isn't going to go up in a straight line until it hits a wall, right? It's going to slow down, and there's a lot of factors.
Right. Yeah. But Malaysia, for example, has not had the collapse that India had. And there's reasons why Malaysia maybe is different from India and maybe from Indonesia.
Well, Eid al-Adha is on Tuesday. It'll be the day before this podcast publishes, and there's a real concern in Malaysia about keeping mobility restrictions in place, so that we don't have. They're still in a third lockdown, I think. There. Come on, Malaysia, get your act in order.
Yeah. Yeah, and it's a concern for Indonesia as well, especially because President Widodo, unfortunately, I think, overrode the recommendations of his ministers and allowed for mosques to be open during these emergency restrictions. But what the government is doing is saying that the mosques are open, but the mosques are not allowed to have gatherings within them, which is a slippery slope, and it's kind of hard to enforce. So, I think it's patchy as to how well that's working. So I think you're still having gatherings and clusters and transmissions in mosques, at least in certain provinces like Banten, for example. And that could actually accelerate with this the Eid al-Adha days coming this week, which typically involve quite a lot of gatherings as communities get together to slaughter animals and share meat.
I'm trying to understand what happened with Kimia Pharma. And apparently I can go down to Kimia Pharma and buy a Coronavac if I want, right? They've got 15 million. They got it from Kadin. And I can get in line and pay for a jab if I so want. But no, you say. But what happened there? They got 15 million doses on offer and for sale that you're supposed to be able to get for free. I don't understand what happened. But you just love the Gautam Royon program. So he said ironically.
Yeah, because you have to laugh. You gotta find some black humor during a plague, and
what happened?
Otherwise, you'll cry. So,
slightly lighter note.
This is just weird. This is an incredible saga that we've been talking.
It's just weird. I don't understand it at all.
Yeah, this is a saga that we've talked about for months now because this idea originally arose from the Chamber of Commerce, CODIN, that its member companies should have an ability to import their own private supplies of vaccines so that their workers can get vaccinated without having to wait for the general population. And government officials thought this was a good idea. They agreed to it, even though I don't think there's many other programs around the world that are comparable. And it was billed as something that would help the government by enabling the resources of CODIN to augment what the government is doing. The idea was that CODIN would charge its member companies 1 million rupiah per full vaccination. In practice, it was different, though, because, in fact, a lot of government ministers and institutions and state enterprises had to get involved in different ways to actually secure these doses. And it put some measure of strain on Indonesia's multilateral and bilateral relations to actually get supplies. And it was mainly China's Sinopharm that came through and promised 15 million doses for CODIN. So it's not really a private sector program. There was a lot of government involvement. Plus, it looks as if the state pharmacy company, Kimia Pharma, fronted the money for CODIN to buy these 15 million doses from Sinopharm, which were not sold cheap. I'm guessing roughly maybe 7 trillion rupiah, or about $500 million is the order of magnitude for the whole thing, which is a substantial sum of money. Yeah. Yes. So then what happened, remarkably, is that CODIN's member companies chose not to use the doses for whatever reason. I think they see that it's possible to get free doses from the government, so they're doing that instead and saving the expenditure. And that's left the government, with this mess. They've got these doses piling up because these Sinopharm doses are now arriving in rapid succession. There's 3 million on hand in the country now, and another 4 million due this week. And meanwhile, CODIN has distributed 280,000. So CODIN's vaccination rate is about 10 to 15,000 doses a day. And that's only just recently. It was even lower before that. And I calculated, so at that rate, it'll take them 4 years to use the full supply. So the government then came up with this idea, okay, well, let's take some of these doses, 400,000 doses, and put them for sale through the state Kimia Pharma pharmacies to individuals who want to pay 1 million rupiah. And it'll be another outlet that'll feed that part of the market that exists out there. And people started lining up in front of these stores at 5 a.m. on Monday morning last week when this was due to happen. But then in between the announcement on Saturday and the stores opening on Monday morning, the government changed its policy and backed down and canceled the sales because there was this huge outcry from NGOs and opposition parties that the government should not be in the business of selling vaccines to the public, which is understandable, actually. However, it still leaves the problem of what to do with these 15 million doses that nobody has paid for, that the government needs reimbursement on. So will the government just take the hit and bail out Kadin and allocate budget funds for that? Now, one possibility in my mind is to take half the doses and give them away for free, and take the other half and sell them at double the price, 2 million rupiah per vaccination, to tourists, if there's a green zone in Bali that can accommodate tourists from countries that have slower vaccination programs. And what's ironic too is that the Kadin pressured the government to cater to its self-interest, basically, then changed its mind and left the government hanging. And the chair of Kadin, in the meantime, received appointment to the coveted post of ambassador to the U.S. It's Rozan Roslani, as a Bakri Group executive in the coal company Bumi Resources, as a commissioner. So it's it's a pretty sad state of affairs overall. But interestingly, there's some opinion survey data showing that the public approves of the Gotong Royong program remarkably. So there's not really critical attitudes among the public about this entire scheme for allowing the Chamber of Commerce to do its own vaccination program, even though it seems kind of unseemly.
I, of course, have a nuanced view of Gotong Royong, because it's the only way that I got my vaccine.
Jeff Nuance Hutton.
I do have a nuanced view. It's the only way. It's the only way I'm going to get vaccinated, man. I do. And there's
nothing wrong with the company doing it or an individual doing it.
Yeah. And I'm not getting. I've got a dose of the AstraZeneca. I didn't get on the list for the journalists, because foreign journalists, and the bureau here is shut down. I was on my own, so I don't know. I'm not going to cast aspersions too much, but I take your point that maybe big businesses with self-dealing, looking out for themselves, and cause more work. It would have been better if there was a more concerted effort, but I wasn't asking questions.
Well, this survey that came out is interesting. This is from the same one I mentioned earlier about the presidential approval ratings. It's the Survey Institute. It was done in late June. And it shows that there's pretty good public support for vaccinations in general. In fact, 85% of respondents say that they agree that there should be a nationwide rollout of vaccinations, and that's the way to go. A lower percentage actually wants a vaccination for themselves, however. So that's about 2/3, or actually 69%. The survey from the Survey Institute asks people if they're ready to take the vaccine or not. So while 89% approve of a nationwide vaccine rollout by the government, 64% are willing to actually take part themselves and take a vaccine, which is quite a bit lower, but it's still a pretty good number, actually. And then what's also interesting is that if we look at the reasons why the other, say, 36% say that they're unwilling to take a vaccination, some of the reasons are kind of sensible, actually. For example, one of the responses given is that, I don't need to take a vaccine because everybody else will be doing it. So therefore, there's going to be herd immunity. And
I don't.
They thought it through. It's true, actually. But the problem is, if everybody thinks that, then it's not going to work. So that's one reason. That was cited by about 4% of respondents in the survey. Another 9% said that they don't want to take a vaccine because they don't want to pay for it. So these are people who are not aware that vaccines are free. So that's just a public information campaign issue. So most of those 9% should hopefully be willing, when they finally are fully cognizant, that they're not going to have to pay for it. Some people said that vaccines might not be halal, and that's their reason for not taking it. And this has been a thing that's been celebrated in the press, the international press in particular, a lot. And that's actually 9% or 10% of respondents. So it's not the predominant factor. the predominant factor, the reason why half of the vaccine hesitant people are hesitant is that they're afraid of side effects. And that's the case around the world. And it's not without reason. Of course, as we know, that the dangers of COVID are several magnitudes of order greater than the dangers of a vaccine, but both have dangers. And so that's the main reason. Then the second one is that some people think that vaccines are not effective. So that's so these percentages are as a percentage of the vaccine hesitant people. So of the 36% who are vaccine hesitant, half of those are afraid of side effects. A quarter of them believe that vaccines are ineffective. The other one is that 19% of vaccine hesitant people say that I feel healthy, therefore I don't need a vaccine. And then 10% of vaccine hesitant people are worried about it being halal or not. So it's 10% of 36%. So it's less than 4% of the population is concerned about the halal issue with vaccinations.
I thought that would be higher. I thought it'd be a lot more.
Exactly. Yeah, it's not that big a deal. Yeah. Unless people are being untruthful. The other issue is that this survey is capturing people with cell phones. So it's missing the 30% strata of society in terms of income levels who are unable to afford a cell phone. So
that's an issue.
That skews the results a little bit. So maybe those vaccine hesitant people are a little bit higher if it was a in-person survey.
Right. And by cell phone, do we know if that's a smartphone or if it's a not smartphone, like the internet-enabled ones?
I don't think it is. No, I think that simply a handphone number, even a flip phone,
Because my Pimbantu was really not keen on it at all. Takut just was nervous about it. And, frankly, the issue got forced because our building requires it. We have to show everyone working in the building has to be vaccinated. And so it's either that or not be allowed in.
Wow.
So sort of forced her hand and forced the matter for her. But, takut can mean any number of things. I didn't really want to press her views on it. And as you can tell, we haven't been home for the past few weeks. But I would be very interested in hearing her honestly speak to her concerns because she is Muslim. It does leave hope that there is some optimism that a concerted effort on the part of the government using trusted people, not government spokesmen, don't roll out Pak Luhut. You gotta get people talking to other people about how the vaccine works. You tell people to talk to their doctor. You gotta hear it from religious leaders. You have to hear it from celebrities. You have to hear it from your neighbors. Can't have someone on high saying, "Go get your vaccine." That
Facebook,
I think, would be please go to Facebook. Should be destroyed. No, sorry. I have no great love for Facebook. But so a concerted public health campaign would whittle those numbers down, would increase the percentage of people who'd be willing to get it. 64% is a good starting base. Is that the way to see it? That the 64% is sort of an opening bid?
Yeah, absolutely. Yeah, when people see that the vaccines are working for the people around them and people they know, their relatives go through vaccination and avoid side effects, then that's going to persuade more and more people. So it's a good starting point, and it's 63% is a figure that should grow over time gradually. And in the meantime, there's plenty of people willing to take vaccines for the foreseeable future. So it bodes well for the vaccine rollout.
Okay, Kevin, thanks a lot for that. I'm going to leave it there. Coming up, Erwin Tegu of CGS CIMB Securities.